The doctor is in. Tampa General Hospital is on the front lines of treating COVID-19 patients. They have been conducting several clinical trials and now will be among the first to be getting the vaccine next month and the first hospital in Florida to administer the monoclonal antibody treatment for COVID-19. Now joining us to discuss is Dr. Jason Wilson from Tampa General Hospital. Welcome to Bloom, Doctor. How exciting is this?
This is a pretty exciting time in a long pandemic now where there's been some gloomy news. There's still some gloomy news, but right now we see a little hope on the horizon with 2 vaccines that will likely be approved by emergency use authorization very soon, and then also 2 monoclonal antibody therapeutics, one that we've been researching for a while now, and another one that's also received emergency use authorization that's here and that we're using on patients right now to treat them and get them better.
And how is that working?
Yeah, so things are going well. We've given it to quite a number of patients. We're finding patients who are appropriate for that medication. These are higher risk COVID patients, but the cool thing about it is these are people who are not in the hospital. So before this, all of our treatments were really for people who were hospitalized or were much more severely ill with COVID. What's exciting about this is these are patients who have a high risk of having to return to the hospital but are able to go home. They come and see us in a clinic and we give the drug there. So people who might be a little older, maybe overweight, have diabetes, high blood pressure, medical problems like that, we screen them for criteria, and if they're appropriate, we get them linked either same day or just the next day to get the infusion.
All right, so now let's talk about what everybody wants to talk about, the vaccines and access to them. I mean, I know Tampa General Hospital, we are so lucky to have this right here in our own backyard.
Yeah. So we are lucky we're one of the 5 sites that will have the vaccine, and we expect this thing called emergency use authorization to be approved sometime in the middle of December. The company Pfizer and the company Moderna will likely have submitted EUAs, emergency use authorization applications, to the FDA. They'll review those in early December, and as soon as that's approved, we expect vaccine to move very quickly to this area. Again, Tampa General will be one of the 5 sites with vaccine. And what you'll see when that vaccine arrives is what you might expect. People who see COVID patients every day, all day, will be the first who are eligible for the vaccine. But after that, we'll start to open the vaccine up to other essential workers. So even people like police officers, teachers, people like that will start to kind of come down the line, and then vulnerable health populations as well. People in nursing homes who have other medical conditions who make them much more likely to get sick if they were to get COVID.
So how did TGH and USF get selected to be one of the 5 hospitals in the state of Florida to get the vaccines?
Yeah, it's a great question. The partnership between TGH and USF goes back 40 years, or more now. And that partnership has just been solidified over time. And the amount of research we do together has been just extraordinary in changing patients' lives over these past 4 decades. And because of that reputation and because of that ability and infrastructure between the university and the hospital organization and all the great doctors and nurses and teams there, we've proven that we can do this and we can do it right. There are some logistical pieces about having this vaccine. For example, the Pfizer vaccine, you've got to have a freezer where you can store the vaccine at negative 80 degrees Celsius. So very, very cold temperatures that you've got to be able to keep this vaccine in. So there's just some logistical pieces about that too. You've got to have a place that can do that and execute that appropriately and get it to a high number of people who are at risk for getting COVID.
So, I mean, everyone likes to talk about the numbers, but I know at Tampa General Hospital there's an entire wing dedicated to treating patients, and you have the best of everything for that treatment protocol. How are things now since the beginning of when this pandemic first broke out? I mean, it seems like we've really come a long way, especially at TGH.
We've come an extraordinary way. Whenever you see a viral pandemic or a viral outbreak, whether it's Ebola or Zika or this, a lot of the care comes from what we call supportive care. And supportive care means having access to ventilators or to supportive oxygen or to having dialysis machines if the kidneys aren't working. But also that supportive care comes to having teams of people who know how to work together and are on the same mission, are going in the same direction. And what's happened since March is that we have an interdisciplinary care team, infectious disease experts, emergency medicine experts, hospitalist experts, nurse experts, this whole team that comes together and knows how to care for a patient. So then we opened up the Global Emerging Disease Institute, the JEDI. We really have this great space now, space, stuff, and staff that can work together in the same direction to make patients better.
You know, it's been a long time since we've had the opportunity to breathe a little bit easier. But having you here today, sharing this information, you know, kind of showing us the light at the end of the tunnel is really so comforting.
Well, it is comforting. It's also a good reminder of that critical message. We are so close, so now is the critical time to please keep on wearing your mask. Please keep on social distancing. Please keep on washing your hands, because how sad would it be to have a case of COVID we could avoid? We're so close to having some other help.
All right. Thank you so much, Doctor. And you can visit tgh.org for more information and updates on COVID. And we've got more Bloom coming your way right after this.